Good morning, everybody, and welcome to this session on psychosocial risks and mental health in the digital world of work. So, my name is Maurizio Curtarelli. Couple of practical information. We are starting a bit earlier and we are finishing a bit earlier this session, so you will have time to move to the plenary room for the final panel discussion. So this session explores the psychosocial risks and mental health challenges that arise from the use of digital technologies at work. We heard yesterday and this morning that digital technologies are transforming the way we work, the way work is organized. New forms of work such as platform work or remote work and hybrid work are emerging. Now, this process brings along a range of opportunities for employers and for workers, but also a number of implications in terms of OSH, in terms of increased psychosocial risks, increased pressure, intensification of work, isolation of worker, work-life conflicts, just to name a few of them, that can result in stress and other mental health issues. The four presentations in this session aim to examine these risks. From different angles, they will share research findings and evidence-based insights and highlight strategies and tools that workplaces can adopt to prevent these risks and make of digitalization an opportunity for all. Now, let me introduce the first speaker, Ignacio González Vázquez, who is an economic and policy analyst at the Joint Research Center of the European Commission, where he works in a research program on the changing nature of work. His research focuses on the impact of the digital revolution on work organization and job quality, considering also other factors such as institutional framework and energy transition. His presentation on digital monitoring, algorithmic management, and the platformization of work in the European Union covers findings from research carried out jointly with you over the last few years and findings from the recent AM Work survey. Ignacio, the floor is yours. Thank you very much.
Okay. Many thanks, Maurizio, and good morning, everyone. It is a pleasure to be here. As Maurizio said, so I'm going to be telling you about recent findings from a large worker survey on digital monitoring, algorithmic management, and the platformization of work that we've carried out at the JRC in collaboration with DG Employment. And so, I mean, the reason why we've done this survey, I mean, we know that the use of digital platforms and algorithms is more and more generalized in traditional workplaces beyond digital labor platforms. Digital platforms and algorithms, by digitizing information and communication flows, are a very efficient way to communicate within organizations and to coordinate work, and this is why they are increasingly used. This is not necessarily a bad thing. On the contrary, however, we do know that the digitization of work processes does create the conditions for a growing use of data-driven management practices such as digital monitoring and algorithmic management. This was extensively discussed yesterday, so I'm not going to get into details there. Digital monitoring, algorithmic management can lead to benefits in terms of coordination efficiency by streamlining work processes. At the same time, platformization can increase the exposure of workers to psychosocial risk factors. That is a recent publication together with the EU-OSHA that explains some of the main psychosocial risk drivers for workers as a result of digitalization in the workplace. Higher work intensity, reduced work autonomy, high cognitive overload, isolation, work-related stress, and also the potential for intrusive worker monitoring and surveillance. Until recently, however, there was relatively scant evidence about this in the European context, and that's why a couple of years ago we embarked upon this large survey that we have just published initial results about a few weeks ago, end of October, and that now we are leveraging upon to conduct additional analysis. The field work was done in late 2024, early 2025, so the data are very recent. This was a phone survey following a CATI methodology, and it's a very large sample, more than 70,000 respondents in all member states of the EU. And in the survey questionnaire, following the approach that we had already used in a pilot survey that was done a few years ago, face-to-face in Germany and Spain, we approached the idea, the concept of platformization by measuring three distinct but closely related phenomena that are closely intertwined. The first is the use of digital tools at work, which is, as you can imagine, the material base that then enables the development of data-driven managerial practices. The second is the digital monitoring of work, and that concerns the use of data collected through digital devices about work processes and workers themselves. And the third is algorithmic management, which concerns the automation of certain workforce management and coordination functions. And so in the survey questionnaire, there is a relatively detailed block of questions about each of these three layers that then allow us to construct the indicators of platformization, and on that basis, look at the impact on working conditions. So I'm going to tell you a few key snapshots for each of the three building blocks, and then what we know so far in terms of the implications for working conditions based on the data. So the first is the use of digital tools at work. This is no news. There are other surveys. There's a lot of numbers there. I'm not going to describe the numbers because there's no time for that. I'll just extract a few key insights from each of the tables, but then I invite you to consult the report, and we can discuss bilaterally after this panel or as a follow-up to this conference or in the setting you consider most appropriate. We're very happy to discuss. So digital tools usage is pervasive. This was said yesterday. The OSHA polls, the European Working Conditions Survey, the Eurostat ad hoc module on tasks, they all point in the same direction. An overwhelming majority of workers report using digital tools in the workplace. There is a strong educational gradient, so basically all highly educated workers use digital tools, but half of those with low education do not use any digital tools, and this is quite significant. There is some variation across countries. I'll not enter into those details. Importantly, we asked a set of questions about the use of artificial intelligence, and that is the column on the right-hand side of the table. And on average, 30% of workers, almost a third, have used AI-powered tools for work-related purposes, at least once in the last 12 months. So we think that is quite a lot, and that's something we can also discuss later. So first layer, digitalization, so the use of digital tools. The second, digital monitoring. So use of these digital tools to systematically collect data about work and workers. And there, what I want to stress here is the three types of digital monitoring that emerge from the data. So here, what we've done, we've conducted a principal components factor analysis that allows the identification of structural patterns in the data. And through that analysis, we see three main types of digital monitoring emerging in the European context. The first is time monitoring, so the use of digital systems to monitor working time, as well as workers' entry, exit, or movement in the workplace. Those are the first two columns and the two bars. As you can see, that is by far the most common type of digital monitoring. The second is physical monitoring. That concerns the tracking of the physical location of workers by means of cameras, sensors, or GPS in vehicles. And the third is activity monitoring. And activity monitoring means the monitoring of activities carried out with digital tools. And this is typical of office settings and concerns, for example, the monitoring of internet usage, the monitoring of calls and emails, the monitoring of social media, the monitoring of computer use. So, in a nutshell, so three clearly distinct types. One, very common and highly generalized in European workplaces, monitoring of working time. The other two are less common, potentially more intrusive. And it is important to know that there is significant variation across countries. And there is a block of countries, mostly in Central and Eastern Europe, that show relatively and comparatively high prevalence and even very high prevalence of some of those other forms of digital monitoring that could be considered more intrusive. So, digital tools, digital monitoring. The third, algorithmic management. Algorithmic management, again, is about the automation of workforce management and coordination functions, and it's not exactly the same as digital monitoring. So we think it's useful for conceptual, also empirical purposes to distinguish between the two, because they are closely intertwined. There's no algorithmic management without digital monitoring, but they are not the same thing. And here, again, with the same type of factor analysis, we see two main types of algorithmic management emerging from the data. Algorithmic direction, that's the use of automated systems to allocate working time, tasks, rate of work, or instructions. And that's the most common type, especially the automated allocation of working time. And then the second is algorithmic evaluation. And algorithmic evaluation concerns systems for automatic rewarding and benchmarking of workers, including also the use of customer ratings or the cancellation of tasks or activities based on those ratings. So here, the automated allocation of work, as I said, is the most widespread form. Algorithmic evaluation is significantly less prevalent, but again, like in the case of digital monitoring, there is significant variation in prevalence across countries. And some of these practices are quite significant in a number of countries. Again, mostly in Central and Eastern Europe, but then also in other countries like Spain, Ireland, etc. So as I explained before, we approach the concept of platformization through these three distinct but closely intertwined realities. And so we use the data to construct a possible taxonomy of workers by level of platformization. And so what we see there is that, first, there is a small share of workers who are not using any digital tools. This is on average for the EU as a whole. A small share of workers that are not using any digital tools and therefore are not platformized in any possible way, because the material base for platformization is simply not there. There is a significant share of workers, a third, who are using digital tools but are not platformized. That means that they are, according to our data, not subject to any form of digital monitoring or algorithmic management. And this is already quite telling. I mean, there's a 40% of workers who are not platformized at all. 60% are, and that means that 6% are subject to some form of digital monitoring and algorithmic management. However, that 60% masks lots of different realities. So 42% fall under what we call partial platformization. That would be the mildest or softest forms of platformization, entailing a combination of one form of digital monitoring and algorithmic management. Then there are two subtypes of partial platformization that, however, are quite distinct, and we have highlighted here because they clearly stand out with very specific characteristics that we think deserve attention. One is what we call informational platformization. That's 9% of workers in the EU. These are workers who are subject to activity monitoring and algorithmic evaluation, which are correlated. This is all on the basis of correlations between the different variables. So it's not categories that we've made up. They come from the analysis of the data itself. So activity monitoring, which, if you remember, is the monitoring of office activities, correlates with algorithmic evaluation, with algorithmic direction as well, but more with algorithmic evaluation. This is more prevalent in office work, so in terms of occupations, is most frequent for clerks, and in sectors such as finance and professional services. Then there is another type of platformization concerning 7% of workers that we've called physical platformization. That means a combination of physical monitoring, so cameras, sensors, GPS, with algorithmic direction, so automated allocation of shifts, working time, etc. That one contrary to the other, which was more prevalent in office settings, this is more prevalent in manual work activities. So the first informational platformization concerns white-collar workers, if you like, cognitive work, while the second, physical platformization, concerns sort of blue-collar workers, if you want. It's typical of manual work activities. It's common for operators and in sectors such as mining, transportation, and logistics. And then last but not least, there's a small share of workers, 2%, but that's a lot of many million workers in the EU, are subject to full platformization. That would be the most intense form of platformization, entailing all types of digital monitoring and algorithmic management. So these are workers who are subject to physical monitoring, activity monitoring, algorithmic direction, and algorithmic evaluation simultaneously. Outside digital labor platforms, I mean, this is about traditional workplaces. And this category, we checked, the fully platformized, doesn't really overlap with pure platform workers. On the right-hand side, you see a snapshot of the prevalence of the different types of platformization by country. Again, I'm not going to discuss that in detail now, but prevalence varies significantly across countries. If the different variables of digital monitoring and algorithmic management show different prevalence, naturally you see that the platformization categories are also spread unevenly in EU countries. Generally, countries in Central and Eastern Europe show high levels of platformization and also of full physical informational platformization. And in Western and Northern Europe, it's lower. And so in terms of working conditions, in AIM-work, we, of course, we have included a battery of questions on working conditions, which cannot possibly be as exhaustive as the European Working Conditions Survey. But we have tried to make sure that we included at least the key psychosocial risk drivers. So there is a substantive amount of information on autonomy, on flexibility, on communication, and also on stress at work. And what we see emerging from the data is a clear pattern. On the one hand, we see that full and physical platformization are clearly associated with increased stress and diminished autonomy and flexibility. So full, 2% of workers were subject to all the forms of platformization, and physical, the 7%, more typical of manual work. There is a clear association with increased stress and diminished autonomy. We don't see that with respect to partial platformization and informational platformization. They do not seem to have significantly negative consequences in terms of working conditions to the extent measured in AIM-work. Here, I mean, this is a worker survey. We don't include here any considerations, for example, about privacy, the use of workers' data, etc. No? So those are all the concerns that are there and that are not measured in AIM-work. But to the extent that we've been able to measure it in AIM-work, again, we're quite confident about the robustness of the data. We see a clear association of some forms of platformization with deteriorated working conditions, but then not the others. And then the impacts are context-specific. We generally know this, that the impacts of digitalization in the world of work are mediated by pre-existing practices, by norms and institutions. Well, the data shows this. Both the prevalence and the impact vary significantly across countries. And the geographical divide in terms of not just prevalence, but also impact is quite significant. So if you see the figure on the right-hand side, you have most of sort of Central and Eastern European member states. In those countries, what we see is that they consistently display a negative association between some forms of platformization, mostly full, physical, also informational in some cases, and job quality. This doesn't happen. We don't see this in the rest of member states, in Western and Northern European member states, with some exceptions, and you see Spain emerging there. What we've done there is we've measured full physical, informational, and partial platformization, and this is an econometric analysis looking at the impact on the key working conditions variables that we have in the survey. So this is all. What I've showed you before is in the report that we published. This is work in progress, this last slide. This is what we're doing right now. It's clearly, in our opinion, pointing at the role of institutions. One needs to wonder, I mean, what is driving these differences? Well, I mean, a natural explanation would be the role of the differences in the regulatory framework, in the institutional framework, in industrial relations between the different member states. This clearly requires more work, and we are now doing that, starting to try to analyze more in depth what is it that is really driving these differences in prevalence and impact. But clearly, I mean, our sort of a key insight there is that the impact of platformization can and should be shaped by labor market institutions. Qualitative evidence, we've also been doing many case studies in collaboration with other institutions, including EU-OSHA, but also, for example, the ILO. Qualitative evidence indicates that industrial relations and co-determination can play a key role. And therefore, well, I mean, this is what I'm going to end my presentation with. Happy to discuss further at the Q&A session. That's a QR that takes you to our website and the reports, and happy to discuss later. Thank you.
Thank you very much, Ignacio. We will take a few questions at the end of the session after hearing the other presentation. So now the next speaker is Caroline Lennartz, who is head of the research group Work Organization and Social Dialogue at HIVA Q Leuven and associate professor at the Q Leuven Faculty of Psychology and Educational Sciences. Caroline mainly conducts research on the effects of digitalization in the labor market, job quality, the working condition and social protection of platform workers, occupational safety and health, workers' representation and participation, and related issues. Her presentation on psychosocial risks and mental health in digital platform work covers findings from research that she and her research team had conducted for EU-OSHA. So, Caroline, the floor is yours. Thank you.
Thank you so much. Good morning, everybody. I hope you can hear me well. It's really a pleasure to be here with you today and to discuss some of the work that we did together with EU-OSHA on digital platform work. The results that I will be drawing on today actually come from two different projects that we did on the topic. So on the left, you see one of the reports that we wrote as part of the bigger project, where we really did a deep dive into OSH in digital platform work. So as part of that project, we conducted an extensive literature review. We also developed 4 cases focused more on policy developments, as well as 4 specific case studies on specific types of digital platform work. So we looked at online content reviewers, handiwork, food delivery, parcel delivery, and remote programming. So quite diverse forms of platform work. And in the presentation, I will give you some examples related to those. Methodologically, that report drew on desk research, a consultation of the focal points, so thank you all so much if you replied to our questionnaire at that time, but also extensive interviews. So we did about 60 interviews for that project. On the right-hand side, you see a related report which focuses on workforce diversity in the context of platform work, and then from an OSH perspective. I know yesterday it was a question that came up in one of the sessions. Did you also consider gender issues, migration status, disability, for example? And indeed, in that report, all of those areas are included. Why did we focus on this perspective of workforce diversity? Because we also know that a lot of times in the literature, in media, it has been said that digital platform work can create new opportunities for labor market integration for some of these more vulnerable groups in the labor market. And we wanted to check the evidence on this and also see if platform work actually replicates some of the existing patterns of segregation that we see in the labor market. So if you are interested in those topics, feel free to look at that report. Just to to start all on the same page, so how did we define platform work in that project? Actually, we adopted quite a broad definition. So all paid work provided through, on, or mediated by an online platform. Very critical, of course, in this understanding of platform work is the use of algorithmic management, and I think Ignacio already did an excellent explanation of what that precisely entails. And what we also see very often in this context of digital platform work is the prevalence of non-standard working arrangements. Platforms often tending to classify their workers as self-employed in the terms and conditions, and that this in fact results in a shifting of risks, responsibilities, liabilities also, including in the area of health and safety, to the platform workers. And that was really a big cause of concern that we took with us in this project. Very important to keep in mind here is we started this project in 2021. Of course, this is a very rapidly developing field, and also we took quite a broad approach, which means that we try to consider the heterogeneity in platform work. So to make it a bit more tangible, we looked at different types of platform work following the typology we often see, so looking at online versus offline work, higher skilled versus lower skilled, less specialized work, but also keeping in mind the degree of control that platforms can actually exercise over their platform workers. Why was this important? Because of course that degree of control tells us a lot about how algorithmic management is used by these platforms, and of course it also gives us some clues on to what extent workers are actually working more in a subordinate relationship, which from a legal perspective is also very important as it informs the categorization of the workers' contractual relationship. So those elements we found were really important. What I also wanted to emphasize, and it came very clear in this project, is of course platforms differ among each other. I think already earlier today we saw in the award ceremony that there are also some good examples, so that's important to keep in mind. And this wider socio-technical context in which we are moving ourselves, that is really important. So in that sense, we try to be as nuanced as we could also in the study. When we started to work, a key conclusion that came quite early already in the project is that if we think about platform work, so I give you some examples of types that we looked at. A first starting point is, of course, that the work activities themselves, if they are executed on a platform or outside of a platform, they come with very similar OSH risks and challenges. So we often give the example of the food delivery rider. If you work for a restaurant and deliver pizzas, or you do the same type of work through a platform, the fact that you are outside with a bicycle, you have the traffic conditions, those are all very similar. However, platform work, especially when we started the project, tended to be concentrated in those sectors and occupations that already had elevated risks. So think about the example of the handiwork in the construction sector, food delivery, transportation sector, and now more and more, and I think again the presentation of a previous colleague already showed that, platformization is moving to more sectors, so also in health and social care we see more movement, and of course these are already sectors with elevated risks. On top of that, platform work does involve additional work and also new combinations of work. So in one of the interviews, for example, a handy worker informed us that they do this kind of work also in their regular job, but now instead of their boss managing the client relationships, they have to do this themselves. And that actually is quite stressful, being in this client-facing role where this usually is taken up by somebody else within their organization. And here, especially, the psychosocial risks come into play, because this also leads to extended working hours, a higher workload, a faster work pace, having this client-facing interactions, and so on. Another key point from the project is that really the nature of and the conditions under which platform work is done aggravate the risks that we identified, but they also complicate prevention and management of OSHA risks in this digital platform economy. So what we found is that actually many platform workers encounter very severe OSHA risks, not only physical but also psychosocial risks, and that the prevention and the management is really lagging behind, and that some of the groups that were already exposed to higher risks now end up in this compound situation. So for example, we know, again from a workforce diversity perspective, that migrant workers tend to be overrepresented in food delivery. So it's a vulnerable group in a situation where we have already elevated risks doing it for a platform. So again, all of this starts to combine. This figure comes from a recent scoping review. So it's not from our project, but I thought it actually illustrates really nicely what we should look at, like what you should think of if we think about the implications on health and well-being in platform work. So Matilda Santander and colleagues, they did this very large review of the existing literature on platform work to date. So this was published just a few weeks ago. And what they really identified as key factors were the business practices of platforms, which you can see on the left, which have a direct impact in that they lead to elevated levels of stress among platform workers. The employment conditions, which of course are also linked to the business practices of workers, which again in themselves can lead to stress. But also the work environment hazards, which you can see there in the bottom. And all of these together, they also lead to some acute outcomes like burnout, sleep deprivation, occupational injuries, and then midterm and long-term outcomes. So this is, I think, a very nice conceptual framework from a recent review. But actually already in our project, a lot of these topics came to the foreground. So I will take you now in more detail through those. So first of all, among the factors really aggravating these OSHA risks and challenges in platform work are, of course, algorithmic management and digital surveillance. So the rating mechanisms, the tracking of workers, automated decision-making, they all have a very big impact in the sense that they can cause anxiety, stress, and exhaustion. Why? Because we see that those shift power balances in favor of the digital platform away from the worker. It was already discussed many times, but transparency is a very big issue when it comes to algorithmic management and digital surveillance. How do these algorithms work? How do they impact workers? And all of this undermines workers' autonomy, flexibility, and job control. And here we saw very big differences across the different types of platform work. So for example, especially in the food delivery context, but also in the online content moderation, workers reported very high levels of algorithmic management in almost every aspect of the job. And I think, again, the previous presentation also really showed nicely how you have all these different levels of interaction. What workers really reported here is this feeling of having no recourse, so there is no opportunity for feedback, no option to address any challenges in case you feel that a rating is incorrect, and this really causes stress among workers. Another point that came up, especially again from a workforce diversity perspective, is that this algorithmic management and digital surveillance can lead to biases and discrimination. So for example, in the case of workers with a disability or chronic conditions, for them it could be more difficult to be online for a long time, to be very responsive. Sometimes they have to take more breaks, they are away for a couple of days and then they come back. But this can lead to you being penalized in the rating and the ranking systems. So in that sense, it does create some challenges. The same with women workers with care responsibilities, for example. Okay, then another point was the unclear employment status and contractual arrangements. So I think we already discussed most of that earlier. Here again, I think the point of the migrant worker is very telling. Perhaps also for workers with a disability and chronic condition, what we realized is that for them in particular, this employment status or contractual relation can sometimes be problematic because they tend to combine work with some kind of income, for example, and the rules on getting access to that income can mean that you are not allowed to work or not certain forms of work. So there we get into a tricky area. Then moving on to professional isolation, work-life conflicts, and lack of social support. So platform work is done in isolation. Often you don't know your co-workers, you don't know even the clients, there's high turnover, and workplaces are not adapted, so blurred work-life boundaries. And all of this was found to lead to sleeping problems, exhaustion, loneliness, burnout, and so on. And again, it also complicates organizing as workers, but also identifying then the workforce so that we can target campaigns towards them, offer training, and so on. And closely related to this, but very important also from a psychosocial risk perspective, is that platform work comes with high levels of job insecurity and income insecurity. Workers often have very little to no control over whether they can work, how much they can earn, how long, and so on. And you have the feeling of having to be available at all times. So one of the workers we interviewed said, I have to be ready and at my computer 24/7, otherwise my ranking drops and I don't get my income. And of course that the work is emotionally demanding. Perhaps to wrap up, so what we also really saw in the study is that there was a very limited awareness and attention for OSH in this platform economy, both among workers, so workers often were not really aware at all of the risks that they were exposed to, and also the fact that their contractual status could have implications on the rights and responsibilities that they themselves had as workers. Some were found to take precautions, for example, taking some breaks if they were working, but most did not, or only at a very limited scale, sometimes because they were afraid to lose their position at the platform. Among platforms, it's a bit the same story. So we found that platforms had very limited understanding of the OSH risks. And when they did, it was often focused on accidents. So really trying to work on that area. But psychosocial risks, well-being, mental health, typically were not discussed at all. It really didn't emerge as a priority. And workers then again were little to not at all involved in these OSH measures. So here you can find the conclusions from our study. You can also read more about them in the report. I think one of the main points that we also wanted to put forward is that it's so important to share good practices where there are examples of platforms doing more to really support workers. And I think with EU-OSHA's campaign, we heard yesterday just how successful it was. So I hope that this was already an important step in that direction. Thank you all so much.
Thank you very much, Caroline. Now I give the floor to Pablo Sanz, who is an associate professor in the Department of Psychology and Sociology at the University of Zaragoza. And his areas of interest include European governance of employment, labor law enforcement, industrial democracy, vocational education and training, and impact of digitalization in the world of work. His presentation covers findings from research on telework, that including analysis of regulation and from a gender perspective that he carried out for EU-OSHA. Pablo, the floor is yours.
I will take the time.
Okay. Many thanks for this kind invitation. I'm very happy to be here today. So yes, what it works. What I'm presenting are several studies that I have conducted together with my colleagues from Notus and also with other colleagues from Italy and France, which have particularly focused on the relationship between telework and psychosocial risk. First of all, the report that you have on the left side, it was conducted, this study in 2021, in a context where the pandemic was really so close in 2020, and we started to analyze the relationship between telework and health, with a particular focus on psychosocial risk. Through a qualitative research, we conducted 50 interviews with employees and around, I think, 20 interviews with employers in Spain, France, and Italy to analyze what was happening in terms of health and safety in this sudden transition towards telework. In the context of this study, we also conducted an analysis on the regulation. So what was happening at the level of legislation in the European member states, how they were responding to this new challenge brought by the widespread use of telework. And in this case, we rely on the reports that the focal points of EU-OSHA developed. This report was published in 2022, and I think it was the first comparative analysis of all the EU countries of the regulation on telework. In the middle, you can see that we also updated this report in 2023. In this case, we used the information from Eurofound. We used national reports developed by the network of national correspondents from Eurofound, so we could update our previous report showing which were the new trends in terms of regulation. And finally, we also conducted this third report where we analyze the relationship between telework and us, but from a gender perspective. When I was reading again this report, I have also been conducting new studies. I have to say that I was very happy with the findings that we got. So we can modestly say that we even anticipated some issues that have been really at stake nowadays. For instance, in terms of patterns of telework, of course, our study was qualitative. We did not rely on surveys, etc. But something that was very interesting in our service was that it was confirmed that telework was here to stay, that most of the employees, most of the employers, even if they reported a lot of problems, they all acknowledged, or most of them acknowledged, that telework was here to stay. So they were satisfied. And moreover, they also stated a preference towards hybrid forms of telework. Of course, at that time, the term of hybrid work was not so popular, but they all said that they were not so happy with those full-time telework arrangements, so they expressed that they had the feeling that telework should be combined with the presence at the employers' facilities. And in the report on gender, we also found that there is still a kind of gender bias, so that women tend to do more telework due to different aspects, such as the distribution of men and women across the occupation, but also due to care responsibilities. I will come back to this later. Yeah, in terms of psychosocial risk, we started our study, conducted a literature review. Again, it should be noted that this was in 2021, so most of the studies that we revised were using data that was taken before the pandemic crisis. So in this context, there were a lot of biases. Why? Because telework was not so widespread, and also because telework was mainly done by a particular type of occupation, so highly qualified profiles with a lot of autonomy, etc. So when they explain the effects of telework on working conditions, so they basically focus on a very specific profile. So what these studies told us about health and safety. So basically, first of all, they saw it that telework was associated to overtime. This is something that still nowadays we see. For instance, the last data from the European Working Conditions Survey shows a correlation between telework and overtime. So teleworkers used to work longer compared to traditional employees. Secondly, also that there was a problem with isolation. Again, this was related to the fact that at that period, some of the workers were doing full-time telework, and this exacerbated the risk of isolation. And thirdly, most of the studies highlighted the issue of work-life conflict. So telework tend to blur the boundaries between work and personal life, and this was a particularly problem for women because due to gender norms, they tend to do more care work. So what did we find in our field work? So basically those outcomes were somehow confirmed, but we also found other evidence and some nuances. So the first issue, we saw it that telework could have negative implications in terms of health and safety because in some cases it entailed work intensification. Why? First, because it increased working time and working time patterns, in particular in the initial stage. So, you know, there was a very sudden transition. So in the beginning, when they were getting used, sometimes they increased the work. But also, this was also related to somehow negative managerial practices. So in some cases, managers were a bit scared about losing control over the workers, so they developed quite intrusive managerial forms. So they were trying to control their workers, sending a lot of emails, checking what they were doing, etc. And this entailed an increase in work intensification or in overtime for the workers. But also, in some cases, what we found in our interviews was that there was some kind of, let's say, self-exploitation of workers. Sometimes workers felt that they had to show that they were working. Or sometimes they even felt that this kind of telework was a kind of gift. So they thought, okay, if you gave us this gift of telework, in exchange, we need to show that we are working harder. Again, this proves that we were, in an early period, we were experimenting with telework, so workers, managers, they were learning, and in some cases, they were making some mistakes, negatives, in terms of health and safety. Secondly, negative problems in terms of psychosocial risks were also related to change in the job content. Again, in the context of this sudden transition, the labor processes were modified. So, in these cases, this change that workers had to do without in some cases without support, without help, entail more work, or sometimes even some frustration. For instance, we saw it in some of the interviews that teleworkers expressed frustration because they felt that their performance were lower compared to the previous experience where they were working at home. Thirdly, we also identified two issues. First, isolation. As I said before, isolation was one of the main risks identified in previous literature. In some cases, we also found isolation as a problem reported by workers, particularly for those employees who were used to work with a lot of interaction with colleagues, etc. So they expressed this problem of isolation. They wanted to come back to the office to return regular contacts with their colleagues, etc. But something more innovative that we found, that was at that time only identified by very few studies, was the problem about virtual collaboration. And this is a problem that I guess that we all have suffered. So when you have to coordinate with a lot of people through virtual communications, this normally entails a lot of risk on problems. Communication is more complex. Sometimes you need to have several virtual meetings, and this takes time that after that you need to recover. And also, sometimes there are problems of interpretations. Sometimes this creates frustration because you have the feeling that you have not been well interpreted, or that you need to dedicate more efforts to pay attention. And also there are other issues related to the stress and the exhaustion. Once you have been paying attention in a virtual meeting, when you finish, you have this feeling that you are more tired than if you have had this meeting on a face-to-face basis. So this was reported by a lot of workers and managers, that this kind of virtual communication was created some problems in terms of stress. And it was also interesting because they were also at that time considering strategies to reduce the number of meetings, etc., because they were aware that this was creating some issues. And finally, we also identified the problem of work conflict. Of course, again, when we conducted the interviews, all the workers had very close the pandemic period where the schools were closed. So in the interviews, they explained us how difficult was to carry out the work with the children there, etc. So it was also funny because the interviews, we also experienced the same situation. So we were crying together, remembering this sad period. And when we talk about war-like conflict, again, the gender perspective is very crucial, because in the report that was exclusively focused on the gender dimensions, we found that there is gender gap in terms of psychosocial risk. So relying on the OSHA pools from EU-OSHA, we found that women who do telework are more exposed to psychosocial risk compared to men. And this is in particularly due to the fact that they are more exposed to blurring boundaries, because they take more responsibilities on unpaid working time. So because of this element, women tend to report more work conflict. And there are also a lot of studies that confirm this idea, that also, for instance, when women and men, there are even experimental studies which are very interesting, because they saw that when women and men are doing telework, the children go to the woman to ask something. So even in this equal scenario, women are suffering more exposure to this problem of blurring boundaries, which again creates stress and negative working and living conditions. What about the moderating factors? So again, we also wanted to analyze which are the factors that can moderate those risks identified. So basically, in the report, we identified three main elements: autonomy. So if telework is combined with higher autonomy in terms of working time, but also in terms of the labor process, so in terms of the activities, the employees can make a better use of telework to improve their working and living condition. This is a very clear finding. Secondly, organizational support. This is a crucial issue, and in our field work, we found some how ambivalent results. There was some organizational support, but was mainly focused on supporting workers with the digital infrastructure, laptops, in some cases, desks, etc. But the organization didn't pay so much attention to the problems of psychosocial risk, because, of course, at that time, there was not so much information, and they had a lot of problems in this transition. So we can understand this. And thirdly, something relevant that has been also highlighted before, the importance of collective bargaining and social dialogue. In the context of the pandemic, social dialogue and collective bargaining was a very important element to support companies to develop tailor-made solutions to improve telework. So for instance, some social dialogue or collective bargaining set up new elements that allow companies to better select those profiles that can do telework, thus avoiding discrimination practices, etc. In some cases, it also became mandatory the provision of laptops when doing telework, etc. So social dialogue and collective bargaining contribute to a smooth this transition in those companies that really develop or relied on these practices. And yeah, finally, something about regulation. I have 1 more minute to say. Okay, very quickly. Yes, basically our study showed some trends, because of course this is something that is evolving very, very quickly. But as I said, it was, I think, that the first report that compared regulatory responses in the post-pandemic context, and we saw it that there were very different approaches. So basically there were some countries, in particular Nordic countries, that only rely on collective bargaining to regulate telework. And in the opposite side, there were all the different countries, some Eastern European countries, some Southern European countries that rely on statutory legislation. But there were some other countries that were also combining both sources of regulation. We also identified that there were new legal responses in several countries at that time. In Spain was a clear example, and we could identify which were the main new topics discussed in the legislation of telework. Because we need to be aware that at that time the only EU reference that we had was the EU Framework Agreement that was approved in 2021. So in this context of telework, which main topics were addressed in new legislation? So basically, it was discussed in many countries the right to request telework, which is still a very important topic nowadays. Why? Because a lot of workers wanted to remain doing telework, And this is a crucial element to avoid discrimination, okay? And of course, the right to disconnect. We also identified that it was a very important issue, which is not only targeted to teleworkers, but it's very important for teleworkers to prevent always-on-work culture, etc. And currently, there are 13 countries that have passed legislation on the right to disconnect, and we are maybe waiting for a new EU directive on this issue. We also saw some specific provision on OSH, on MSD, and in a very few countries on psychosocial risks. Again, in this case, Spain was a good practice because it was one of the few countries that explicitly took the problem of psychosocial risk in the context of telework. And finally, from a more critical perspective, we can say that what we observed was that most of these initiatives were gender blind. So they were not taking into consideration problems that from a gender perspective should be considered because they entail different working conditions. So I guess that's it. Many thanks.
Thank you very much, Pablo. We have now our last speaker, last but not least, Geronimo Krieger, who is an occupational psychologist at the Central Labor Inspectorate of Austria, where he's working on the enforcement and further development of OSH from a psychosocial perspective in Austria. Thanks to the cooperation with OSHA and the Austrian Focal Point, he brought the campaign outcomes into the organizational knowledge of the Austrian Labor Inspection, collaborating with the Austrian Associations for Psychology and the Austrian Federal Ministry of Defense to develop a digitalization risk matrix, a tool to carry out workplace risk assessments that takes into account the use of the digital technologies in the workplace. He will tell more about that in his presentation. Geronimo, thank you. Your floor is yours.
Thank you for the introduction. I need 15 more minutes of your attention, please. Then we can have the break. Thanks for the colleagues for their valuable insights. Now we try to boil it all down and get as practical as possible, because we know that's where the magic happens, right? So the presentation is called Enter the Matrix. First of all, who has seen the movie? Please give a quick hand sign. Yeah, perfect. I have a short reference for you in a minute. So it's all about the humanization of digital workplaces. And why is it called Enter the Matrix? The answer is super simple. We matched the 5 campaign areas with the 4 psychosocial risk dimensions of the risk assessment, including tasks, processes, social relations, and working environment, including working equipment. But why did we do that? Well, when it comes to digitalization, we have a lot of terms, a lot of buzzwords, and it can become too much very quickly. So if that happens, our vision gets kind of blurred, and we don't want a cloudy vision, we want a clear view. So what we want to do is to demystify all these terms one by one and get to some very precise action. So please, everybody, take the red pill. Have a close look. Take the real world into account as it is in the company and be very precise about it. And now everybody can take his or her cell phone and enter the matrix, please. So you now have the website of the Austrian Labor Inspection, and then you have just a simple matrix of all the psychosocial risk factors. And I'm glad to announce that there's everything in there we just heard. So nothing missing there. And so that you don't lose it, you can send it to a colleague or to your own work email address if you want, and then turn away that phone. So there are a lot of risk factors, impossible to go through all of them. That's why I have a short scenario for you and a short demonstration how to use it. So imagine we are now in a digital logistics company. They have a quite aggressive digital transformation strategy. They already implemented warehouse automation, AI task management, remote work, and continuous performance monitoring. So what do we do as OSH experts to start with such a company? And the answer is clear. We have a look into the metrics, of course. And when we go into the column of AI workers management, we can find a risk factor quite quickly. In this case, digital tracking and monitoring options, which have to be designed in order to be not a health hazard, but possibly useful to do your work. So now we have a hypothesis which has to be checked in the company, right? So we need our OSH experts to have a close look. If it's occupational medicine, occupational psychology, safety experts, in the best case they are all working together. And it doesn't take long for them to identify a real risk in a job category of order fulfillment specialists. Because there's a tracking of time between picking an item and completing the parcel, and that leads to internal competition and stress reactions in this particular company. So countermeasures have to be set. In this case, they introduce a requirement to average a reasonable time value without tracking it. And while their inspection, they also identified different target groups. In this case, workers above 50, workers with limited domestic language skills, and trainees who just entered the company. So we have a very clear measure and also a deadline, of course, and they also checked how to do the efficacy monitoring. In this case, a quick survey should be enough, and see if the stress reaction declined for the different target groups. And as easy as that, we improved some digital working conditions, and that's what it's about, right? So have a look again. If we scroll down a little bit, reduced autonomy and control comes to our eye, and for this company we should check that, right? Because we know there can come health hazards with it and reduced resources as well. So our OSH experts have a close look again, and they identify really quickly that for the job category of robotic system technicians, there is a dangerous stressor from algorithmic task allocation because it leads to excessive workload and reduced room for maneuver. And we know this combination is associated with cardiovascular diseases. So it can't stay that way. We have to set a countermeasure. In this case, it's clear we talked about it. We need a co-determination. The algorithmic system should make reasonable, good suggestions and leave the actual decision to the worker so he can work efficiently, and it's helpful. Again, we have a deadline for implementation, and in this case, the efficacy monitoring maybe should be done by an occupational psychologist, including an observational interview to really see the work in progress and if it's dangerous or not. So again, as easy as that, there's some real clear measure and a real deadline, and we have improved some working conditions. So that makes the OSH experts happy for the day. So what I want to suggest, use the link to the metrics in your prompts in any large language model you use, and make it create a table to fit it into the OSH scheme. And by taking the link, you make sure only good information comes into that table. And it's really easy to plan your inspection, your consultation, or in general as an employer to create a healthy working systems, one factor after another. So I tried that, and it's quite a helpful overview to come to quick results, something to talk about. So when you can talk about precise risks, it's easier to come up with just the fitting measures. So there are different job categories. There are also, it's also telling you if the risk level is rather high or medium. And what's interesting, the large language model I used came to the conclusion that all staff has a risk because of a lack of participation. So we talked about that a lot during the last 2 days. And yeah, we went through that. The same digital system can be useful or harmful depending on how it's implemented. And participation plays a big role. So this tool we developed together doesn't replace psychometric tools to do the risk assessment in a good structure, but it complements it in a very useful way, I think. Because we know in practical work it is a necessity to get very tangible as fast as possible in order to have that precise conversations. And we intend to speed up the process of getting tangible, because when it gets tangible, it gets manageable. So, do I have time left? How is it? Yeah, a little bit? Okay, so I used the time to talk about a topic I always want to talk about when I have the opportunity. The pandemic of loneliness, loneliness is more prevalent in digital workplaces. We have more isolation, which can be measured, and it's connected to the subjective experience of loneliness, and loneliness is associated with premature mortality, more than obesity and lack of exercise combined. So it's a real health hazard. We have the risk factor of social isolation because there are more solitary workplaces technically possible, and when we have algorithmic management, you don't need to talk with one another that much. And again, when we have the blurring of private life and professional life, also the private resources decline. So you cannot stand that much demand anymore. Yeah. It's becoming dangerous. Also, the human interaction, like I said, changed or is changing rapidly. Yeah, I don't need to go into detail, I guess. We know all what we are talking about. So, but what can we do? I want to encourage everyone to have real contact persons for employees, and don't stop having it, and do different activities to assure group cohesion. Especially for platform workers, it's important to have real interaction areas. Under certain conditions, the use of social robotics can be thought of. And yeah, avoid solitary workplaces wherever possible. So I hope the mist has lifted and you have a clear vision now. Let's create some humane working conditions. Thank you.
Wow, thank you very much for this very interesting tool that could be easily replicated in other countries with some adaptation and translation, obviously. So now let's get back from the matrix and let's open the floor to questions. Okay, we have one there, one there.
Thank you very much. Thank you for all the presentations, they were really great. Have a couple of questions. One for Ignacio, because now what you were presenting, since academic minds are sometimes ill, I was thinking what you present is too easy to attach these differences across countries to institutional conditions. So I was thinking, what about risk normalization? I mean, workers that have been exposed to technologies for a long time, they tend to undervalue the risk associated to those technologies. And since those countries, Eastern European countries, maybe technologies haven't been so prevalent until recently, those risk factors are more apparent now to workers. It's just something that came to my mind, because when you look also about prevalence of use of digital technologies, the picture is the reverse. So I was thinking maybe it's related to that kind of normalization of risk, together, of course, with the existence of institutions that mediate those risks. So it's kind of, but it's just an idea that came to my mind to complicate things for you, of course. And the other question is for Pablo, because when you were presenting, there is this thing about the intensity of telework, right? I mean, there is a kind of U-shape thing. So I was wondering to what extent that is something that, kind of also explains the perception of risk. I mean, people that telework very little are unhappy, people that telework a lot are unhappy, kind of right in the middle, like 2-3 days, I don't know, is the exact amount of telework, and that makes you feel everything in a different way. Also the risk entailed by telework and isolation, etc. So to what extent that's something that you came across in your research? Thank you.
Thank you. Do you want to have a go to reply? Yeah, please.
Yes, that's a good point. Of course, I mean, this requires a lot of further thinking. One thing that I didn't say before, and I think should also be stressed, is that, I mean, we've been so far looking at these platformization categories we have built. We also need to look in detail at the different variables, the different forms of digital monitoring and algorithmic management that are built into these categories, because my intuition is that it's certain practices related perhaps to physical monitoring, activity monitoring, algorithmic evaluation that are more consequential for working conditions than others. So that requires in-depth analysis, and we're working on that right now. The way the questionnaire is built is, for first, the workers were subject to a set of questions on working conditions. Then we went through the block of questions on digital tools usage, digital monitoring, algorithmic management. The questionnaire is really about very concrete and tangible experiences that workers can directly relate to. In that sense, while there could be some of that, I don't think the questionnaire would lead to that type of interpretation, because the questionnaire is not about judgments or perceptions from workers. It's about very tangible experiences. However, that is a serious argument that deserves further consideration. So it's a good point. Thank you.
Thank you. Pablo? Yeah, thank you for the question. That was a bit our conclusion, that in order to reduce those risks, a kind of hybrid arrangement can contribute to prevent those problems. However, it is not the only solution, because, of course, this has to be combined with other aspects such as autonomy, support, etc. And finally, there are also problems, because when you develop hybrid work arrangement from an employer's perspective, for instance, if you say the best scenario is that we avoid to have online meetings. So the days that you are in the office, we organize the meetings. So when you go to your place at home, you can concentrate and, for instance, writing the reports in case you do that. So that will be the ideal scenario. But from a managerial perspective, it is not so easy how you organize the time that workers spend at home and at the office, how you coordinate this. So from a managerial perspective, this also entails problems of coordination, etc. So the question is yes, but it is not that easy, I will say.
Thank you very much. Next question, please.
Yeah, first a question to Caroline. So on platform work, and it's more a methodology question. You have a very broad definition, but yet very quickly all the examples are about the usual suspects: food delivery, transport. So what with the use of platforms in inspection, maintenance, cleaning, auditing, training, healthcare, with more predictability, more transparency, more autonomy. Then on bias and discrimination, you compare within the system. Why don't you compare with the same activities that are not in a platform? Because As you probably know, at the ILO, we are currently discussing platform work with a lot of studies showing better access, more inclusivity on almost all discrimination criteria compared to non-platform work. And here the drivers are the best example. Those people would never get a job in a traditional taxi company, yet they are all Uber and Lyft drivers. So, and also on job insecurity, why don't you compare with the people in the same kind of activities with employers not using a platform but probably becoming obsolete in the near future, so loss of work, loss of income. So that's a methodology question. And if I may, on telework, again, methodology question. What I always miss is I don't like the COVID as a turning point. Telework is there more than 30 years. We have lots of colleagues with 30 years of experience. So why are there no studies comparing the early adapters, the period, the institutional period from 2002, the framework agreement, and the situation now? I'm missing that because what we're missing in the whole discussion is the fundamental principle is still voluntary. So even if both sides, worker and employer, are aware of all the risks, why do they still choose telework? And the most dangerous thing, I think, is as soon as you use the words more exposed or severe for telework, the framework directive and the hierarchy, the prevention hierarchy would oblige employers to say, come back to the office. That is the consequence. I'm not sure that we are willing that, but that is the risk. I see our employers using more and more these studies to reduce telework. So then we go against the basic principle of voluntary approach, voluntary agreement. So that's a tricky one.
Okay, thank you. Do you want to get back to Chris, please?
Of course, thank you so much for your questions. They are really important, I would say. And we didn't have too much time right now to go in all the details, so the report is way more nuanced. We did the 4 case studies as part of the larger project, but in the report we didn't really, we looked at more. So some of the examples that you mentioned, like cleaning, is also covered in yet another project, auditing and so on. And I think in any kind of discussion on platform work, it's very important to be as nuanced as possible, but it's not always so easy. And that's also why I wanted to emphasize at the start that even if we are talking about certain types of platform work, still within those types, you see huge differences between the platforms among them in how they organize things, transparency, and so on. In one of the interviews, for example, it came up that one of the programmers that we spoke with jumped from one platform to another multiple times to really try and understand, okay, what conditions now work best for me in my specific situation. The definition was quite broad because when we started, there were multiple definitions put forward on platform work, so we wanted to keep it as open as possible to really get the overview of the landscape. And I think the questions on comparing with others, precisely because the definition was so open, it was really not possible to go very much in depth, but I do take the point, so I think it's important nuance. Thank you so much.
Yes, thank you for this question. Well, I think it really makes sense to compare telework in the pre-pandemic and the post-pandemic, and also that makes sense to say that telework is totally different after the pandemic. And you come from the ILO, right? So John Messenger from ILO has a very nice paper. No? Okay. So, sorry. So John Messenger has a very nice paper that is called The 3 Generations of Telework. And he clearly makes a distinction between how telework was in the 80s, when you were given a computer and you say, okay, bye. Stay there, do whatever you want. Then it changed with the laptops, but then it totally changed with the smartphones, where you can work anywhere, anytime. So telework is different because technologies are different, and telework is also different because in the past, only few people in a company were doing telework. So the situation totally changed, whether all your colleagues are doing telework, or when you go to the office and you do not have your desk. You have to search your desk, or, well, my desk is busy, I need to come back to my home. So, of course, Ulrich Beck in the Risk Society already mentioned telework in the 80s, but telework is totally different nowadays. And finally, regarding the regulation, yes, I think that voluntariness is crucial, and this is why I think that the right to request is so important, because what I think that regulation and collective bargaining should make sure today is that this discrimination on those unbalance between those people who the company wants to offer telework because to attract talent or because they want to compensate them, they are not the only one that use telework, that telework can also be used for work-life balance, etc., and to be given to all the people that want to do telework. So telework should not be imposed, and also no one should be discriminated. So yeah, thank you.
Thank you very much. I can take one last question because we have to go to the other room for the panel session. Michael, a short question or a short answer from panelists?
Thanks, Maurizio.
Please.
First of all, compliment to all 4 presenters for excellent presentations. My question is for you, Geronimo, because I love your matrix. I love the idea of it. But the last slide, when you said you processed it, and the large language model you were using said all staff are impacted and the risks are high. And that's one of the big threats we're finding with large language models. Everything is coming out as high because of the inbuilt biases that pre-exist. How do we start tuning them? So, because when you do everything, and if everything is high risk, it becomes difficult to prioritize. And when you look around, you think, Jesus, this must be a really dangerous place. And yet it isn't. So how do we actually attenuate what we're getting back from these LLMs?
Yes, thank you. First of all, I wouldn't use it if I'm not I'm not an expert in the field. I always need the expertise to know when it's wrong. So use it with care. And I just found the result interesting because it said all the employees are impacted. And that's just a basic principle, the participation when we implement digital working system. So maybe it doesn't make so much sense to include it in every single risk assessment, but use it as a basic design principle when implementing anything. We knew that for quite a lot of time, but now that there are so many systems coming into place, so we just need to do it that way.
Okay, thank you very much. I suggest those of you who have questions, please approach the speakers now at the end of the sessions, or send us an email, and we will be happy to forward your question to the speakers. Thank you very much.